FM90. Brought to you by Housing Finance Bank, a financial institution regulated by Bank of Uganda. Housing Finance Bank, we make it easy.
Your views, our interviews on Spectrum, Radio 1 FM90.
A very good evening to you, and thank you very much for joining us on this edition of Spectrum. We are live on Radio 1 FM90, which is in the central building in the heart of our city, Kampala. We are also live on our website, which is www.radio1fm90.com. You click on the icon with the word Listen Live. Radio 1 also presents you other alternatives of listening in. You can use the different radio listening apps, which can be downloaded from the Google stores of your smartphone. You can also do that via DSTV, audio channel 897, and on StarTimes, our audio channel is 97. Today, we'll be looking at the Stole de Lubowa Specialized Hospital Project and what we are missing out. Now, the Lubowa Super Specialized Hospital is back in the headlines following a decision to block opposition MPs from undertaking an oversight visit to the site yesterday. Now, upon arriving at the site, the team led by Leader of Opposition Joel Senyonyi was intercepted by police and the army, who told them to seek clearance from the Inspector General of Police. Now, this situation culminated into a debate in Parliament today, and there were a number of issues that were put across, including a proposal that no further funding be provided until Parliament is fully abreast with what is happening. Now, this hospital, which is a 1.4 trillion project, is a brainchild of an Italian national, Enrico Pinetti. It was started in 2019 and was expected to be completed in 2 years. Last December, an extra 2.7 billion shillings was released through a supplementary budget for supervision purposes. But in Parliament today, MPs were wondering where that money has gone, given that there is no project to supervise. Tomorrow, a team led by the Deputy Speaker of Parliament, Thomas Tayebwa, is expected to go to that site to provide a report back to the House. So today I have two guests in studio who will analyze for us this situation. They are all active members of the medical profession. They work in the area of health. One of them is Mr. Peter Echeru, who is the Program Coordinator, Advocacy at the Center for Health, Human Rights and Development, CEHAD. Good evening, Mr. Echeru. Thank you very much for joining us this evening.
Thank you very much, Kenneth, for having me here, and it's a great pleasure to come and have a conversation about this very important matter.
We're also going to be joined shortly by Dr. Ekwaro Buku, a physician. He's also a researcher and health policy expert. He served previously as president of the Uganda Medical Association. Peter, let's begin with you. I know you were around and closely following these issues when this project was actually brought forward. From the onset, what was your understanding of this project, and how important was it going to be in the health sector?
Thank you very much, Kenneth. So in 2019, the idea was then that this would be a private facility that would provide super specialized services to Ugandans. And I think the argument that was made at that time was that it will cut down on our export of patients out of the country and ensure that we are able to provide these services locally. But then, of course, the strange thing is that the business person in that specific hospital was not getting a loan from a bank, but that government would provide resources that would enable that person to provide, to develop the hospital. But then after 10 years, then it would revert to government. So if you look at that, for us on our side, first of all, we found that extremely strange. Because one, the whole idea of government, especially when you're talking about the health sector, is ensuring that we have equity in the provision of health services across the country. Certainly, as a country, we need super specialized services. And the ideal is that everybody should be able to access, to have a fair chance of accessing quality health services. And so it's not that we do not have any infrastructure in the existing health facilities. We have capacity. existent resident capacity, whether it is at Mulago, whether it is at Naguru, all these have capacity, some form of capacity. And so what we need is to strengthen that capacity and make sure that they are operational. So the ideal thing from our perspective, especially if you're looking at it from a health equity perspective, is that government would invest in the public health delivery system, as opposed to, for example, doing the same for a private facility. Because if you invest all that amount of money in a private health facility, and it is still being run as a private health facility, it will still lock out a majority of people in this country. By the way, over 70% of Ugandans get health service delivery in Health Center 2, Health Center 3, Health Center 4. 70% of Ugandans, that's where their health service delivery areas are. And so, my thinking is that if we wanted to help the system, ensure that everybody is able to access, that's where we are. As a country currently, we've done so well in terms of accessibility to health facilities. I think Ministry of Health statistics show that almost 90% of Ugandans now live within 5 kilometers of a health facility. So if we strengthen the functionality of Health Center 3, Health Center 4, district hospitals, we would be able to deliver a good product for patients in this country. So investing that huge amount of money, first of all, in the private facility defeats the purpose of providing public health facilities. And so it is problematic. What would have been ideal is that the person goes to private sources of funding. Actually, out of this country, you're able to get more money at a better interest rate out of this country if you have a bankable proposal. And that's what they would do. So that's part of the bigger problem that we have with that whole process. Then now the issues that come in after that even make the situation terrible. We are allocating resources, but see any physical changes that are happening on the ground. I was one of those who appeared before the Health Committee to make proposals on the National Budget Framework paper for the next financial year. And one of the things we are saying is that the economy has had hits. And so what would we need now at this point is not to do a lot of heavy infrastructural development using borrowed money, but to ensure that the resources that we have are placed on functionalizing already existing health systems that we are having, so that they are able to serve the purpose for which they are meant to be. Most of our health facilities are operating below capacity simply because we've not invested money there. Now, the money that we should be investing there, we are investing those monies into exclusive health facilities.
But this was a one-off. We were going to remain with a super specialized hospital after 10 years, which would become a national resource.
Yes, but then...
Build, operate, and transfer. Those projects exist.
But we already have facilities in this country that we can upgrade and make super specialized. I can tell you, if you go to Mulago, we have requisite human resource there. What only makes Mulago unable to do things that, for example, the Kenyan hospitals where we are going to all the time, is not that we actually don't have people to run the places. We simply don't have equipment that we've invested in to be able to enable health workers perform their function. So it would cost us actually less to functionalize our existing systems, get the required equipment, have our required manpower recruited, and run them. It would be more cost effective to do that instead of starting a new thing. You'll notice we have a lot of unnecessary referrals from the districts to Mulago here. Those referrals would not actually be happening if our health system, Health Center 3, Health Center 4, and the district hospitals were functional. A lot of problems that we are referring to Mulago now would actually be dealt with at district and regional hospitals. We would not need to have... So that would reduce the congestion at Mulago, first of all, but also enable Mulago to have a free hand to provide more technical support that would the likes of Luboa would be doing. So now people who are coming here, you remember the conjoined trains that were brought from Teso to Mulago? And Mulago said, take them back. And they were operated on at Rotary General Referral Hospital under very difficult circumstances. So if we made those investments at that level, we would free Mulago Hospital to deal with more super specialized.
All right.
All we would need now is to equip and continue to retool the health workers that are at those facilities.
All right, let's bring in the views of Dr. Akwaro Buko. If I'm not mistaken, this project actually came at a time when you were at the Uganda Medical Association, not so?
That's why I came today.
That's why you came today.
A déjà vu.
You have fresh memories about the arguments which were fronted then as this hospital was being proposed. Here we are now. According to Parliament, there is nothing to show. What are we missing out, Dr. Buko?
Thank you very much, Ndugu, for calling me back here. I'm pleased to meet my colleague. I missed his name, though.
Echweru?
Honorable?
No, Peter Echweru is a program coordinator and advocacy at the Center for Health, Human Rights and Development.
SEHAD. Yes. Oh, wonderful. So SEHAD does a lot of good work. First of all, I had to throw in a disclaimer. Very, very important in my line of work, that I do not represent the views of the Medical Association. Neither do I represent the views of any client of mine as a consultant, or even a future employer, if they may want to. My policy science is
Dr.
background.
Ebuku and his head.
And his head. So with that disclaimer, I can go ahead to say this. When Luboa Hospital came about, there were two perspectives. One was that it is a white elephant. Isn't it? It was too good to be true. Is the need there? Yes. But we argued that it is a black elephant. Why? Because with a white elephant, you build it, you finish it, you hand it over, but it does not fulfill its original objectives. You are getting me? Because the original objective is to answer that need, to diminish the need for Ugandans who cannot afford and then go abroad. Why am I saying Ugandans cannot afford? Because even those who go abroad are paid for by government, meaning they cannot afford. But we go to our collective tax basket and pay for those who have access to power and decision making. And therefore, that would have been a white elephant. Now, why are we saying it is a black elephant? Luboa Hospital is a black elephant because, according to the debates I've been seeing among doctors, is that perhaps, given this advanced era of artificial intelligence, maybe they are building it underground. And we are on level 5. That's why we are not able to see the magnificent structures which were presented earlier.
Which is a possibility.
Maybe they have decided to go underground. Some people are saying maybe it is a transparent. It is one which you can't see, but it is there.
Where are they putting the gravel, the things that they're digging from underground, Dr. Buku?
So, more seriously, I think Luboa Hospital was a very good idea, which was conceived by the state to, first of all, provide for a unique service, medical tourism, in the country to solve that problem. Issues to do with the transplants, issues to do with, complicated surgeries, particularly, and really advanced medicine and surgery. And the government was on track, by the way, because at the time I was president, the government had trained 100 for lack of a better word, super specialized doctors. Super, just to use the English word, but I think they call them subspecialties.
For that project or
For the
generally?
country.
For the country, okay.
Mulago and so on, because the need was there.
Okay.
So that, you provide the human capital.
The need will always be there.
But a government was answering. And about 100 of my senior colleagues went to India. Some went to other countries. I think Italy and other countries. And they came back. Unfortunately, Mulago was also not
Fully equipped.
ready. But I'd like to thank my colleague, Dr. Rubabinda, who at least oversaw the first kidney transplant. That is now supposed to become daily bread in Mulago. But because Mulago handles from malaria to diarrhea to pneumonia to now kidney transplant, it was important to have something like Lubowa Hospital. Despite it being very, very expensive, okay, since life has no cost, we can say, okay, it is very expensive, but it's there. But right now, it is not there. And this is the fundamental question. If we have allocated, I don't know how much. I'm reading 270 billion. Is that the correct figure?
About 400.
Hello?
Yes.
400 billion. So we have allocated over $100 million.
The project is worth 1.4 trillion. And from the debate we had in the House, 400 billion has been dispensed, and 2.7 billion was dispensed last December through a supplementary budget for specifically supervising the project.
So 2.7 billion is the money medical interns are crying for. You know what I mean? 2.7 billion can do a lot. That supervision, which I'm very sure we have engineers in works, we have engineers in health, but more importantly, what were they supervising? But more critically,
What do you mean? What were they supervising?
What were they supervising? If there are no works which are seen, perhaps it's the foundation which has taken how many years now? 4 or 5? Because that was around about 2018.
2019.
2019. So around about 4 years.
There was that explanation about the COVID-19 lockdown.
And that was the best time to build.
Actually,
I recall even the president himself issued a directive
was supposed to go on.
giving special consideration for construction because that's the type of economy that at least was moving. Very many people completed their projects because they were stationary and able to supervise. But the other important point is that one of disinvestment. At what point shall we say this thing is a deal gone bad? We are at 30% financing. We can save the 70%. By the way, 400 billion is a lot of money. It is perhaps, if I'm not wrong, it is $100 million. And that could easily be twice the total collections of tax in 1986 by value. So if it was $5 million, I don't know, or $50 million, perhaps $50 million we were collecting in 1986. Isn't it? Assuming we're collecting 5 billion and the rate was 1 to 1,000. Isn't it? So down the road, we are spending it in one facility. That investment decision may not be the wisest, but according to those who okayed it, I think they looked at it from various angles. Government has very important experts who know how to make these decisions. And eventually, of course, they persuaded the president who okayed it. So it should be a good investment. But at 30% in terms of money, we need to see at least level 2 or level 3 coming up. Or even since they normally start with the backbone, the structure until the top, then they start finishing. Perhaps we should even be on level 7 if it was supposed to have level 7. Or if there were supposed to be 6, 7, 8 buildings, we should be seeing 2 or 3 of them, which we are not able to see. And therefore, to me, my personal view is that let us mobilize our leaders, including the president himself, to disinvest. Unless, him being a guerrilla man, having won, according to his mustard seed, defeated the government with 27 guns. Perhaps, given the instability in Great Lakes region and his unwritten assignments to pacify Somalia, to pacify Congo, and wherever our army is, at times governments can use such a front to buy weapons, which would otherwise not be financed through straight-up purchases. But then, of course, the military, according to the Public Finance Management Act, I believe, has classified expenditure. So again, what would explain this amount of money going down that direction and not appearing anywhere? And we know His Excellency the President has bought jets worth, was it $700 million? The Sukhois? It did not need to go through back door. Okay? And he thought, though, that security is number one.
All right.
So these are just speculations. You will try to explain why would the government, which was on track, because come to health services, yes, there are very many challenges. But when you look at outcomes, life expectancy since 1986 has gone up from less than 45 to above 65. It's not the best in the region. Countries like Rwanda are still pacing us by 2 to 3 years. Okay, yet they are younger in terms of how they matured from the war. If you look at child mortality, you looked at the UDHS, Uganda Demographic and Health Survey, the most recent one. Maternal mortality has gone down, child mortality has gone down, stunting and so on. Many of those things have generally declined. But that is proportionally.
All right.
The absolute numbers are still wanting. The number of women who die due to giving birth is still unacceptably high. Malaria is back with a vengeance. Okay? NCDs, blood pressure, diabetes, cancers are on an exponential rise. You saw the missed opportunities of treatment. Cancer Institute, if you go there, they have really increased their budget. They are independent. They are really unfunded priorities at the Ministry of Health.
All right.
Where this money, by the way, this money, the total of this money is 10% the whole Ministry of Health budget. If you look at 3 trillion and you are giving 400 billion over this period, it is 10%.
It will do a lot in the sector. That's what you're saying.
It will do a lot in terms of, the opportunity cost.
Mr. Chweru, can this project be salvaged from local things? You seem all to agree that it was a good idea, but then something has gone wrong. So can it be salvaged? Should we focus on actually ensuring that it takes off?
I am not sure whether this can be salvaged. But looking at how it is being managed, that worries me. The impunity, the way the systems are being managed. If you have a parliament, and this is not the first time this has happened, that members of parliament are barred from accessing the facility. This is not a security facility. It is just a health facility that is being built. So when you see signs like that, because even the last time I think members of parliament were locked out, it was the same complaints. No work is being done at the site. And the same thing is happening today. So what happened probably over a year ago shows us that maybe even the next 1+ years, when you want to go back to that site, you'll actually find no work done. Because what explains that level of deployment in an ongoing construction site? Just because very unarmed citizens have gone to monitor. People who actually allocate resources for this project have come to monitor. They have just they have just passed a supplementary budget of 2.7 billion for monitoring of that health facility, for monitoring of the construction work at that facility. And then you have a whole the deployment of the police, of the army at the site, as if these people have come to storm the place and break it down. So that impunity, the way the processes are being managed, worries. It shows that we are actually not ready to be accountable for the resources that have been allocated to that for that construction, and that we don't want anyone to know what comes out of it.
All right.
So my judgment is that 2 years from now, we will be back at the same spot.
All right. Spectrum on Radio 1 FM 90. Let's go for a break now, but keep your comments coming using the WhatsApp line, which is 0703 090 090. Our topic of discussion today is the Stalled Lubowa Specialized Hospital Project and what we are missing out. I'm speaking to Dr. Ekwaro Buku, physician researcher and health policy expert. He served previously as the president of the Uganda Medical Association, and Mr. Peter Echweru, program coordinator advocacy at the Center for Human Rights and Development, CEHAD. Stay tuned to Radio 1 FM 90. Spectrum continues after this break.
Spectrum on Radio 1 FM 90.
Thank you so much for staying with us on Spectrum, which is live on Radio 1 FM 90. We are discussing the Stalled Lubowa Specialized Super Hospital projects and what we are missing out. The government in 2019 did agree to fund by guarantee a 1.4 trillion hospital project in Lubowa, brainchild of an Italian national, Enrico Pinetti. It was supposed to help the country save on the amount of money that is being taken abroad in terms of referrals. And the plan was, after 10 years, this hospital would revert to the government of Uganda. And in Parliament, there are questions being asked about where this hospital is. And yesterday, a team led by the leader of opposition was in Lubowa to check on the site of the project, and they were blocked from accessing it. The House today decided that tomorrow, the Deputy Speaker of Parliament will lead a delegation to this site and present a report in Parliament. Dr. Buku, do you think the leader, the Deputy Speaker of Parliament, Thomas Tayebwa, will most likely have his way tomorrow to be able to see what is in Lubowa?
If he calls the president and the president gives him permission. Because I think Lubowa Hospital, I have seen clips where the contractor seems to be reporting directly to the president.
But the contractor was Rocco. Rocco abandoned the site.
It is not Rocco. It is Pinetti.
If you look at the contract documents, Pinetti is the owner. The company that is handling the project is owned by Pinetti. Can I tell you something? But the contractor is Rocco.
Let's do this. Let's compare notes. Mulago Hospital, if you go there, at least $25 million was invested in the renovations. Some places are so good, some places were not finished. Because of challenges with the contractor, who was Rocco. At no time did the MPs, who by law provide oversight of government projects, the other duty is to, of course, allocate the money, and then they follow it, plus others, legislation and so on. But when it comes to Lubowa, they have been denied. The executive cabinet, how can you deny the Minister of Health? Even the permanent secretary. She's very powerful. She's the most powerful permanent secretary. Let me finish. She's the most powerful permanent secretary we have had. Dr. Cheng. I think there's a time they went 3. I think she was part of the delegation. This is not the first time. I think the Prime Minister, did she not make it there one time? Did she not try to go?
No, she tried.
Yes. Now, Prime Minister is the leader of government business. You are getting me how serious this matter is. Who is above the Prime Minister and who is above the Minister?
Parliament. And who is above? The Speaker of Parliament is above the Prime Minister.
It is the President. Okay? Who is above them all. So, I think Right Honorable Tayebwa has to call the Muse, bembeleza him, and say, Muse, now you see, Ugandans, sent us to Parliament to represent their views. They also elected you, or at least you are declared the winner in 21 by a majority vote, EC. And now they just want to know this very magnificent idea of a hospital. How far has it reached? Are you going to open it before 26? So that, we also tell them that the NRM is coming back in a big way. And one of the promises in the manifesto is we are killing medical tourism by opening this hospital.
And we have secured their lives.
And then they say, my son, the way you have talked, I've seen the light. You just go there. And he can put all those people at bay. Because who can deploy soldiers to stop government officials, senior government officials? I know it has happened before. I think Justice Bamgemerin, she was chairing a commission on, I think, land inquiry. Was it land? Yes. And she was unable to visit
Locust,
a particular hill. But, of course, again, it was a security issue because I saw security bigwigs like Ofono Opondo coming out to support that decision, and I understand. I think that man was promoted. Or you got him.
Ofono Opondo?
No, the fellow who stopped that committee from accessing
all right
that high security facility. So, in short, political power in the NRM starts and stops in Plot 1 Nakasero.
This has nothing to do with political power.
No. It is very important. It's very, very important because the person who is the contractor, the other one is the service provider, Rocco. The contractor is Pinet. Isn't it?
Pinet is the owner.
Yes, the contractor.
The owner
is the contractor.
Okay.
Yeah, because it is a contract to build,
operate, and transfer.
So it's a contract arrangement. But those who are going to do the actual service provision, she's perhaps the one managing. And we've read media reports. You people have done a good job to suggest that there is a strong relationship with the president. And perhaps that is where all of this mystery could be coming from. But it would be a good idea to be transparent as part of democracy, which is a pillar. A pillar, I think, number one of the NRM, that the people want to know where their money is going, and even the service they are going to use, how soon is it coming about?
All right.
By the way, who has details of the project timelines? How far are we? It's a question.
The project was supposed to be delivered in 2 years.
Yes.
Oh, very ambitious.
We are here.
Perhaps they would have given it to Sudir. He managed to deliver the venue for Chogum, the Rwenzori Convention Center.
For NAM.
For NAM. Sorry, for NAM and for G77. Working day and night, and it looked impossible, but he did it. Maybe he would have. And what did it cost, by the way? That hotel, we should check. Perhaps it was
around 18 billion.
Yeah, it was not 100 billion. At least if you have done 400 billion, let us see 20 of those.
All right.
Sprinkled around Rubon.
Mr. Chweru, this discussion fits in the overall picture of financing for health in the Ugandan context. You stated here that you were among those people who appeared before the Committee of Health in line with the current budgeting process. What were you able to say? Are we improving? There have been fears that donors are likely to relax their contribution to the health sector because we know they provide the biggest percentage. How are we doing this time around? And that brings in the issue of what we are missing out with these kinds of investments that are being placed elsewhere.
So if you look at our budget currently, the health financing, the donor funding for health constitutes about 40% of the overall health sector financing. But that is consistently going down, that it's consistently reducing. But also what is important for us to note that while government is contributing about 60%, most of that 60% goes into recurrent expenditure. So you find it in things like salaries, things like consumables that you use in the health system. But when it comes to capital expenditure, we are spending about 7% of that 60% only on capital expenditure. So if donors withdraw, a lot of our capital expenditure in health, upgrading of health facilities and all that, will not be able to do that. And so even these expenditures that you see like Luboa would not be able to manage that. So it is something that we really need to think as we invest in the health sector. Are we investing strategically in areas that will change the overall health system? We've been talking about moving from a curative health system to a more preventative health system, where you prevent people from falling sick. Where is the money? We are not investing in those areas. And evidence has shown clearly that countries that invest in primary healthcare, which is the preventative arm of healthcare service delivery, actually save more on treating their patients. And so that's where we need to really spend money into areas that are strategic for the country, that will deliver a lot of results for the community. In this country, if you're sick, you're on your own. Because you'll go to a public health facility and you'll not find medicine. If you're lucky to find a doctor, they'll give you a prescription and you go and find where to find medicines. Medicines continues to be a huge challenge for the health sector. Procurement of medicines. I have looked at needs assessment by National Medical Stores and Ministry of Health. And it shows that actually for you to invest, if you invest about 240 additional billions in the procurement of medicine, you would have largely met all the needs for essential medicines in this country. Additional 240 billion, or about half of what we've already given Pineti currently. If you invest only that in medicines, then you will have transformed our health system. Because as we stand now, absence of medicines is one of the challenges that lead to non-functionality of these health facilities. If you look at mothers dying because they cannot access blood, we are allocating 23 billion, about 22 billion for blood collection, processing, and all that. But we still have a shortfall of about 150,000 units of blood annually in this country. So by just allocating additional maybe 5 billion, you'll save very many mothers. They
actually want 10 billion.
So
the transfusion services. No. Their issue was recently in Parliament.
It should even be reduced.
As it stands currently.
It should be reduced. I know why, because I've been a part of that struggle.
Yes.
Not every problem requires money. I can put my left hand to be cut. Blood transfusion services does not need more money. They just need to be efficient. Perhaps those who actually need money are national medical stores.
But also it's important to note that in relation to blood...
Let me tell you the story. Let me finish.
The figure they're quoting actually does not necessarily mean that they need the money for operational purposes. There are so many other things to buy, reagents.
No.
They have to complete regional blood banks. There are projects that are ongoing, and to be able to equip them to do that work.
With improved roads, with improved coordination. I know this because my colleague, Dr. Bahizi Archibald, who is now the DHO of Chiboga, he was sent to the Rwenzori region to become the principal medical officer of Uganda Blood Transfusion Services. He found Rwenzori region a blood-thirsty region, a blood shortage region, a blood net deficit region. Because of his strong, good leadership, because of his efficiency, he made Rwenzori region a blood surplus region with no additional funding. Are you getting me? Sometimes these are management issues mixed up with more money. For instance, let me also give another example in the health sector.
Let's blow it a little bit and look at the whole health sector, and you apply that notion you're giving that sometimes it's about being efficient.
Yes.
Where are the gaps? What are the things we need to tackle?
Also, when it comes to human resource, I was part of that struggle. And I was serious and not a direct beneficiary of that salary increase. okay? An indirect beneficiary, because we thought, our theory of change was, if we cut out doctors from being absent from hospital because they must go and make extra money in due practice, okay? By supplying them with this money, then they will hang around. I'm afraid it's not always the case. I move in several districts. As part of my previous job, I was a senior technical advisor at Mackay University, IDI, moving to many of these frontline districts in terms of outbreaks. And I would ask the DHO, how are the doctors? Because I was very concerned that we pushed government to triple salaries, okay?
Very
and I wanted to know, is there a return on investment? In many cases, yes. In some cases, absolutely no, if not worse. And recently, in comparing notes, doing some anecdotal anthropology, we understood that some doctors now, because of taking loans and doing business, these are a few bad eggs, okay? But it is my call. I know they are there listening, some of them. Nurses, doctors are even earning higher than the cow. The Lord Mayors of these cities, okay? They should be able to show Ugandans that, yes, we are taking this huge chunk of the cake. The doctor who was earning about $3.5 million senior consultant is now at 3.5 million shillings, is now at 13 point something million. Who increases your salary 4 times? We fought, yes, we argued. Now can you come to work? Then come early. And when you come, can you work? Don't overblame, National Medical Stores is doing this, is doing that. You, what are you doing? So this and we fought for blood transfusion services money. We pushed, and Keith Mwaka has increased it. It was 9 billion to 21. It could not, the appetite could not have increased all of a sudden. No system can absorb that money very quickly. You get what I mean? So let us look at the efficiency issues. Let us tackle corruption in some of these places. Let us, put in place people who can absorb this money, but with trust. As far as I'm concerned, there is no Ugandan who should complain that there is no blood, except when there is the bad habit of selling blood. Health workers, please don't sell blood if you're selling it.
All right. Very quickly.
For me, if you're... Sometimes increasing money does not change, and as you're saying, efficiency issues are critical. But how do we then ensure that the health center force, for example, that we've upgraded, are able to have blood within, are able to have blood fridges within, if we do not? Actually, at the point we're speaking at now, Uganda Blood Transfusion Service still has one of the lowest staffing rates, if you compare them with most of these other other bodies like Uganda Cancer Institute and the rest. So they still continue to have one of the biggest staffing ratio. If you look at the equipment that they have as we speak now, I don't know whether all these are efficiency issues or you need to allocate money. Because you've upgraded a number of health center force, you need to equip them with blood fridges, for example. So how do we manage that if we do not allocate them additional resources?
All right, we have comments coming in from the listeners, and we'll sample them, and you will respond to them. Ekwaru, said, Dr. Ekwaru, the Lubowa thing is not a black elephant, it's a yellow elephant. And he claims it is a conduit to siphon taxpayer money for some people within the government. And then somebody else writes and says, Uganda ceased being a nation with Dr. Bote. That's another comment there. Somebody else writes and says, this is Walakira Charles, let Parliament hold the passing of the budget for the facility, simple as ABC, if Parliament is not just playing to the gallery. Samuel Yiga, listening from Namlondo Zone, says, thank you for the program. Sincerely speaking, it's high time for the government to hand over to people who can do things the right way. We have another comment. There's too much impunity coupled with lack of transparency and accountability in this thing. It's unfortunate senior government officials don't seem to want to account. Then we have another comment from another listener who says, honestly, the NRM MPs, who are many, should be the ones leading the fight for Ugandans. NRM MPs are always silent except when they have to vote in favor of their interest. Well, those are some of the comments that are coming in. And gentlemen, let me give you an opportunity to actually respond to some of these comments. Somebody else has also sent in another comment. Lubowa Hospital is a hoax and just a conduit for swindling taxpayers' money. The evidence is the same. And he says when the team goes there tomorrow, they will not find anything. That's a comment there from another listener who unfortunately did not leave a name behind. Let me begin with you, Mr. Shweru, as we come to the end of this show. Maybe even to reflect going forward, what are some of the lessons Parliament should take from this kind of development? Because they are the ones who appropriate the funding. They also scrutinize the applications by government to actually borrow. And they also have a say on some of these critical projects that are ongoing in the country.
For me, what really beats my understanding is that no one wants to give an explanation to Ugandans on what exactly has happened at Lubowa. Nobody. The Ministry of Health has spokespersons. Since they lead the sector, I thought they would make a statement on some of these important matters. But no one, everybody is quiet. When you only hear about Lubowa is they're asking for money, or there's a group of people attempting to reach the site. Questions
are being asked right now.
Questions have been asked, too many questions, but very few answers. No one has explained to people in this country, not even to Parliament, what exactly is happening
in Parliament. The Prime Minister, who was represented by the third Deputy Prime Minister, Honorable Rukia Nakadama, indicated that they were going to find out exactly why the MPs were blocked from going there, because they had clearance from the Ministry of Health, which is the official owner of that project.
And exactly, no answer has been provided. You're just saying we are going to inquire. And I can assure you some positions are too small. They cannot handle these very big issues. And so they, apart from just saying we will inquire, beyond that, there's really nothing much they will tell us. And I can think in my wild imaginations that even after tomorrow, we'll still have questions about Lubowa. And no one is going to answer those questions for now. Because it is the powers that be that are in charge of that project. So it's until maybe the president comes out and speaks about Lubowa. Maybe he needs to arrange another address. Not a national address. This time not on national security, but on health security issues. Maybe that's when we will be able to get answers to what exactly is happening in Lubowa. Now, for Parliament frustrates a lot. Sometimes you think, yes, there is some logic that people are trying to see that there is a problem. But I will tell you, 3 months from now, when they come and ask for another supplementary budget for Lubowa, they will pass it. I am happy that the Health Committee, in its report on the National Budget Framework paper, has proposed to Parliament that we actually hold any additional financing for that hospital and concentrate the money on functionalization of existing public health facilities. But you know, that is the position of the committee. What the whole House chooses will be another matter. But I can assure you, like day follows night, that when a request for supplementary budget comes through, and Lubowa is one of those, it will pass. But that is where the Parliament has let us down. Right. Because Parliament must act as an independent entity and to be able to check the executive. Where you go to a site like this, you're not seeing any work. You've been passing budgets. You've given them 400 billion shillings. And there's no results. And you continue to allocate. That is frustrating.
All right, Dr. Obuku, your closing remarks as we come to the end of this show.
Thank you very much again for inviting me. I will close this show with the figures. Lubowa Hospital would have built about 8 Kirudu hospitals, if not 10 actually, or more, at a cost of 40 billion. But I think Kirudu was even cheaper. Was it around 20 billion? Yes, sure. So it could have been even, much more, isn't it? 20 Kirudu hospitals. It could have built other regional hospitals, the size of Arua Regional Referral Hospital or Masaka, perhaps 5 of them. the Kayungas of this world, perhaps
right.
5 of them.
All right.
It could have also taken care of 2,000 medical interns for every year for the next 4 years at a cost of 100 billion. Food, DSTV, so that they stop complaining. You see what I'm saying?
All right.
It could have filled in all the gaps. I'm reading from the statement of the president of the Medical Association that they did a survey in the hospitals. Just recently, he gave a press statement this week on Sunday. The gaps are from 21%
All right, Dr.
to 63%.
I'm afraid we have
All
come to
these
the end of
gaps
the
can
show.
be filled in
All right.
systematically with the Ruboa money.
All right. With that, we come to the end of Spectrum today.
100 billion a year.
Thank you very much, Dr. Kwaro Buku, for turning up to share with us your views. And thank you very much, Mr. Peter Echweru, Program Coordinator, Advocacy at the Center for Health, Human Rights and Development. Thank you very much, dear listeners, for sharing with us your views. Up next, we have the news in English with Ms. Josephine Dagano. Thereafter, we'll have the Soul Train with BB Junior.
Spectrum on Radio 1 FM 90.